Us on the news briefing for this Wednesday. We'll go ahead and get started with our COVID-19 information. And I see Kristy Michie from the health department with us this afternoon.
Good afternoon. I think last time I was here was before Christmas, so we're in a much better place than we were mid-December with COVID and flu and RSV and all the other respiratory viruses. I don't have much of an update for today, not much changed probably since Dr. Moreno's update last week. Our COVID numbers are holding stable, our hospital capacity looks good. And, we continue to recommend measures to reduce people's risk, particularly vaccination. Vaccination is very effective in reducing the risk of hospitalization and death from COVID-19. So there's lots of opportunities to get vaccinated. I just want to mention one that's coming up. The Public Health Bureau is hosting a vaccination clinic in partnership with Santa Rita Elementary School on March 4th from 10 to 2. We will be vaccinating folks, everyone 6 months of age and older. I know we've heard some feedback from the community that they're having trouble finding vaccination opportunities for young children. So we want to make sure everybody knows about this. We welcome you to come out on the 4th and see us. We're also offering Jynneos vaccine against Mpox for those at high risk. It's another opportunity to get vaccinated if you weren't able to do that in some of our earlier clinics. So just wanted to remind everybody about the importance of vaccine and some upcoming vaccination opportunities. And I think that's all I have. I'm happy to take questions.
Thank you. And there, I see we had someone having a little trouble getting onto the briefing, but we've got your first question, Kristy. Let me get to it. According to the county website, COVID-19 case, test positivity, and hospitalization rates are up from a month ago. Does the Public Health Department view these rates as trending upwards or remaining steady?
So I tend to look at data on a longer time span than most people do. I'm looking at this as from our December peak that, we're still below that level. I would say right now, I would consider our trends to be stable, both in test positivity, case rates, and hospitalizations.
Thank you, Kristy. Next, any other questions for Kristy today? Sometimes it just takes a second to have them come in. All right, here's your next question, Kristy. In the region that includes California, a month ago, the COVID-19 Omicron BQ.1.1 subvariant dominated with 36.7% of cases. Now XBB.1.5 leads with 70.4% of cases. What has public health learned about the XBB subvariant, and why has it become the dominant strain? And I hope I got that right.
Well, I'll start with the why first. And I think that the answer is we've seen different variants. The SARS-CoV-2 variant has evolved over time. We've seen variants come and go and be replaced. I don't think the variants we're seeing now are the last ones we will see. This is a virus that evolves very rapidly and continues to change. So I think the why is this is behavior. This is the behavior of this virus. It will continue to mutate, has and will continue to mutate. In terms of what we're seeing in terms of variants in the region, I think what we know is that as we've seen these variants emerge and evolve and be replaced, each variant has tended to have an evolutionary selection for being more transmissible, and some of them have picked up mutations that make them a little more easily escaping the immune system. The good news is what we've also learned about whether we're talking about BQ.1.1 or XBB 1.5, or even some of the newer ones emerging, the CH1.1, is that our vaccines tend to continue to be very effective against preventing severe illness, hospitalizations, and deaths. So that's really what we've learned about these variants, is that the vaccines continue to work and are continue to be important as a way to protect the health of the public.
Thank you, Kristy, and thanks for walking us through all those. We know the variants and subvariants exist. They can be a little complicated for the average person to walk through. Here's your next question. The CDC ranks Monterey County's COVID-19 community level at low. What are the best strategies to keep COVID-19 transmission levels low?
I think the important thing is to remember about what people need to do to protect themselves. Not everybody's risk is equal. So at this point, what I would really recommend is for people, particularly over the age of 65, to consider getting the bivalent booster if you have not already. What we have seen in our data, and you can see on our data on our website, is that folks over the age of 65 are at a much higher risk of severe illness and death from COVID-19 than any other age group in our county. And so it's really important that those folks take the opportunity to get their bivalent booster if they haven't already. Also, they may want to consider wearing a higher level of respiratory protection when out in crowds, in crowded situations. So thinking about upgrading their mask, wearing a mask and upgrading it from the standard surgical mask that loops over your ears to the more protective N95 respirator. All of the common sense measures that we have talked about throughout the pandemic are still important. So wash your hands frequently, cover your coughs. If you are sick, please stay home. Even if your COVID test is negative, please stay home. You have some kind of respiratory virus, and you don't want to spread it to others. So that's really important in keeping transmission levels low, is to stay home when you're sick. Also, testing remains important. There are still opportunities for testing, even though some of our state-sponsored sites have closed. Testing is important. Also, if you are in a high-risk group and you do test positive for COVID, have a conversation with your doctor about antiviral medications and whether they are right for you.
Thank you, Kristy. And always great to remind people that those good common sense measures we've been talking about for 3 years still apply. As much as they did then, they apply now. Next question. When do you expect the COVID-19 emergency declaration to end in Monterey County?
I'm going to have to defer that question to the county administrative office staff to follow up maybe an answer.
Okay, thank you. And to the person who asked that question, I will forward that for a response and hopefully get it back to you in time for your deadline. Any other questions for Kristy today? Well, this is a question for me. Will Monterey County Public Health Weekly COVID-19 briefing end at that time? Since we don't have an answer to the first question about when the emergency declaration will end, I'll have to answer the second question when I get an answer to the first question. So sorry about that. We'll have to get back to you on both of those. Any other questions? All right, well, that worked. All right, that looks like all the questions for you today, Kristy. Thanks very much for being on the briefing today and for great information.
Thanks for having me.
We're going to keep up with the topic of COVID-19, but in a little bit of a different way. Our business sector was hit very hard during the pandemic. Most of us know that, and many businesses are still recovering. The Monterey County Business Council is honoring local businesses with COVID-19 Survival Awards. And here to talk about that, plus some other great programs for local businesses this week, such as the first ever Black Business Summit in Monterey County, we have Jose Barajas from the Monterey County Business Council. Hi, Jose. Thanks very much for being here today.
Hi, thank you for having me. Let me share my screen. All right. So first and foremost, thank you all for having us here today. My name is Jose Luis Barajas, and I'm a program analyst for the Monterey County Business Council's newest program called Building Business Back. Building Business Back, for those of you that aren't familiar with it, is a program of the County of Monterey in partnership with the Monterey County Business Council. So what does Building Business Back do? Building Business Back serves all businesses in Monterey County with an emphasis on those operating in unincorporated areas and those that are owned by women, minorities, and/or LGBTQ+. All of our services are free because the County of Monterey has dedicated funding to helping businesses recover from the COVID-19 pandemic and thrive. At the onset of the COVID-19 pandemic, the County of Monterey received over $83 million in ARPA funds. And of those $83 million, our Board of Supervisors decided to allocate some of those funds to supporting our businesses, hence Building Business Back is here to serve the entire County of Monterey. Additionally, our program serves as an information hub for business owners. As a business, finding all these different resources, whether it was PPP, EIDL, the employee retention credit, among other programs, by the time you usually find out about them, funds have either run out, deadlines have already closed, or you don't know who to contact, what all that information entails. So our team actively researches all these federal, state, county, and city-specific grants, loans, professional development programs, and we're all skilled and well-versed on all of these to help you match you up to these different resources and help your business be successful and recover from the pandemic. Additionally, all of our staff is fully bilingual. According to the U.S. Census Bureau, over 60% of Monterey County is Hispanic, and over 54% of Monterey County residents speak a language other than English at home. So in order to best serve our community in the language that they speak, all of our staff is fully bilingual in English and Spanish to help the greater number of businesses. Additionally, we hold a variety of free workshops, which we've already mentioned, the Black Business Summit, among other programs and events that we host. We cover a wide variety of topics, whether that's legal issues, financial or digital literacy. All of our workshops are available in English and Spanish, with the added feature that this year we'll be hosting some workshops entirely in Spanish, with interpretation available into English if English participants wish to participate in those. Additionally, we have some lunch and learn events, which you guys see pictured here. Lunch and learn events are great opportunities for business owners to sit down, have a conversation with us, and have some free lunch, additionally, and get some free resources for your business. So it's a win-win. Additionally, we can help you match up your business to certain grants, loans, and other programs. And we'll also sit down with you and apply for these programs. If you don't know how to, if you don't know what documents you need, our staff will walk with you every step of the way. Now to go on to the events that we have coming up. We have 5 main events coming up in the next month. We have 2 remaining for the month of February, which is the first ever Black Business Summit. And in this, what we envision is to support our Black-owned businesses by having a panel discussion about the history of Black-owned businesses, the financial impact they have on our economy, and how we can better support our Black-owned businesses. We're also going to have Black-serving organizations, such as the Black Business Association, that's going to be present, and the Governor's Office of Economic Development is also going to be present to share some of the resources that are specific for Black-owned businesses and minority-owned businesses. Additionally, as we mentioned, the COVID-19 pandemic really affected all of our businesses. So in recognition and honor of that, Monterey County Business Council is hosting our COVID Business Survival Awards this Friday, February 24th. And we're celebrating and honoring outstanding contributions to our community by the private sector and other organizations. And it's also MCBC's 25th anniversary. Our anniversary was postponed due to the pandemic. So we're also celebrating our 25th anniversary, a little bit delayed. Additionally, we have a lunch and learn event next month on March 9th. It's going to be out in Castroville for those of you that are interested. We're going to be sharing about some new resources available for your businesses. Lunch is on us. It's going to be at Barajas. So if you're interested in having some good Mexican breakfast in March, please join us. We also have a workshop on safeguarding against ADA lawsuits. There's been a string of serial ADA lawsuits being filed against businesses throughout Monterey County, but specifically in Salinas. So we want to help make sure that our business owners know how to be compliant with ADA regulations beforehand and what to do to safeguard their business in case they're presented with a lawsuit. Lastly, next month is Women's History Month. So in recognition of that, we have our first ever Women's History Month event called Lady Boss Women Mean Business. And we're hosting this in collaboration with the Monterey Touring Vehicles Company over in Monterey. Again, a free event. Women, you're all welcome to come. We're going to have representatives from women serving organizations women business centers, women serving financial development corporations, etc. So we're going to connect you with some resources. It's a really great opportunity for you guys to find out about more information for your business. And that concludes all the information I have for you guys. Here's some contact information. If you guys want to visit us in person, we're located right next to the county offices here in Salinas, over at 123 Capitol Street, Suite B. We're just upstairs. You can call us over the phone, send us an email, or visit our website. We look forward to helping your business thrive. Thank you.
Thank you very much for walking us through all these great events and these great things that you have to offer businesses. I'm wondering if you might talk a little bit about what businesses are telling you now. I know the Monterey County Business Council really helps support businesses through the pandemic, but what are they telling you now about recovery? Where are businesses at? And I'm sure it varies, but where are they now, and where would they like to be?
Well, they would like to be in a better position than they are now, for sure. Again, the COVID-19 pandemic greatly affected all sectors of the economy and industries in Monterey County. So as you mentioned, the needs are region and almost city specific. So the needs of the hospitality businesses that are primarily based on the peninsula are different from the needs and the primarily ag-based industries in the valley. However, what we're mainly hearing from our small businesses is that they still haven't fully recovered in their sales. They're still having trouble paying with things like utilities, and that's most of the assistance that they've been requesting, particularly given the recent winter storms that we had and the emergency declarations that came along with that. They were hoping to get a few more resources that we're still working with other partners to try to provide some rental assistance or some sort of utility assistance, which is the greatest needs at the moment.
So there are still needs that businesses may still be having these lingering after effects of the pandemic. There's still a reason for them to reach out to you and find out, if there's some help available. They may be surprised to find there is help.
Definitely. So that's part of why we really try to collaborate with our community organizations. We have formal partnerships with the various chambers of commerce, the Salinas United Business Association. Our team also does in-person visits to businesses. So we're there on the streets, we're talking with business owners to try to connect them to resources. Sometimes business owners are a little bit afraid to reach out and ask, but we want you to know that we're here to help. And then again, our resources are free, and we want to make sure that you're successful. The county wants to make sure that you're successful because it's important for our overall economic recovery efforts.
And then one final question. When we were sharing the graphic about the Black-owned business summit, we had some inquiries about how many Black-owned businesses are in Monterey County. Is this summit a way to find out all the Black-owned businesses that are out there, because they may or may not be known to you?
Yes, definitely. So that's something that we're actively working on. We're working on compiling a list of all minority-owned businesses, whether that's Hispanic-owned, women-owned, LGBTQ-owned, African-American-owned. We want to gather a list for two main reasons. One, so that the community can support them. If you want to go support a women-owned business, an African-American-owned business, there's not really that many resources out there with a comprehensive list of that. Additionally, whenever there's resources that are minority specific, say there's a grant specific for women, there's no real way to do targeted outreach for them or to let women-owned businesses know. So through our collaboration and through hosting this event, we're using this as a stepping stone to build that conversation and try to get more people to self-identify and even get certified as a Black-owned business, because there's a whole separate process for that.
Thank you. And I hope you guys have a great time at your COVID Survival Award gala, and happy birthday to the Business Council, or happy anniversary. And we're glad you're here. Thank you very much, Jose Luis, for joining us today.
Thank you.
And then our last topic: how is mental illness handled within the criminal justice system? There is an upcoming free workshop that will provide valuable information that could help someone you know or a loved one in a time of crisis. This workshop is on March 9th, and it is in both English. It has English and Spanish options. We're very pleased to have friends from the Behavioral Health Bureau of the Health Department. We have Melanie Rhodes, who's the Deputy Director, and our friend Dana Edgull, who has been on the briefing many times. Hello, ladies.
Hi, good afternoon. Thanks for the invitation to come share about this free virtual workshop event. It's open to the community. And again, as you said, will be held on Thursday, March 9th from 5:30 to 7 on the topic of mental illness and the criminal justice system. Interim Incorporated, our county contracted provider of behavioral health services for those with serious mental illness who may or may not also have a co-occurring substance use disorder, will actually be hosting this event and providing the moderator for the discussion that will take place. The format's really going to start as a discussion with a panel of speakers that will be representing law enforcement, the district attorney's office, public defender's office, and behavioral health. And then there will also be the opportunity to have a 30-minute question and answer period. So those who are attending or joining the workshop will have an opportunity to ask any questions that come up for them as well, and then get a response from one of the panel members or more than one of the panel members. But the overall goal of the workshop is really to provide the community with information about how they can help a loved one who may be experiencing behavioral health crisis. Some of the topics are going to include how to communicate with dispatch if you're calling for assistance, or how to communicate with responding law enforcement as well. Also, how to communicate with the county jail if someone is arrested and there's medication or mental health information that you would like to provide to the healthcare providers in custody, how to do that, as well as how to access care back in the community post-release from custody, and just other information about the various collaborative courts or diversion programs that are available as an opportunity, or as an alternative, I should say, to incarceration in some cases. So we're going to cover some of that and a little bit more. And there you go, sharing the flyers. We have flyers in both English and Spanish that do include the registration link for the community to register for the event, and Spanish translation will also be available. So thanks for having us.
Thank you. And I'm hoping you might talk a little bit about who is your target audience for this. I think it would be a really broad audience, but people may think, well, do I really, is this for me? And they might be surprised to know that this is ideal for them. Mm-hmm.
Yeah, it's open to anyone in the community who would like information on this topic. I think, there's a lot of data and information out there about the numbers of folks that end up in our criminal justice system or in our county jails who have behavioral health issues, whether that's mental health or substance use disorder issues. And oftentimes we get questions from family members or loved ones about, wasn't really sure what to say or what information to provide to law enforcement, or, how to get information to the healthcare providers in the county jail to let them know, oh, they have a mental health issue, they should be on these medications, and to share that information. So just hopefully we can answer some of those general questions, but anyone's welcome to attend, and having representatives from the district attorney's office and the public defender's office, they'll also be able to share from their perspective as well about some of the collaborative courts that are available, and just other programs that in the general community might not be aware of exist for individuals with behavioral health issues.
Your lineup for this event is pretty impressive. There are a lot of really great people there. And for people who may have a family member or a loved one with one of these issues, this is a chance to go to the source if they may feel that this, who knows what could happen, but it's possible that their loved one could encounter one of these situations. And here are these people right there to ask those questions.
Mhm. Yes.
Would people be surprised to know how many programs are available if there is a crisis situation?
I think so. I think there's opportunities. There's lots of overlap. Behavioral health often shows up in places where the community might not think of us. In terms of interacting with the different schools throughout the community, interacting with our law enforcement partners or other first responder partners, collaborating with our hospitals and the emergency departments, jail, parole, probation. Like we have a lot of collaborations that we build, nurture, and continue to grow to really meet the needs of our community. And so there is quite a bit of overlap. And also with homeless outreach and mobile crisis services and expansion. So yes, we're definitely out there and involved, and there's a whole forensic team that works with our justice partners related to court. So for those individuals that do have legal issues related to a mental health or a substance use disorder, there are specialty courts programs that are set up that may surprise folks to help folks with, drug treatment court, for example, or DUI court. We also have a veterans treatment court and military diversion and mental health diversion and just other types of courts. And so hopefully this workshop will be an opportunity to ask questions about those things as well.
And I put up the flyer one more time to remind people that, again, this is March 9th, 5:30 to 7, and it is a virtual workshop so that you can take part in the convenience of wherever you happen to be at the time. You don't have to be anywhere specifically. And you can see all the people that are going to be there. This might be a chance to think about questions that you have and be ready and ask questions of those that you may or may not have to ever encounter in your lifetime. Any last points you'd like to make about the workshop? Again, English and Spanish. So people, there's no language barrier. They can use the access code and it will lead them where they need to go to get the correct language.
Correct. And I just want to reemphasize it's free, so no cost. So if there's anyone out there who's just even interested in the topic, feel free to join.
Thank you. We did share the flyers with our community partners, and I see, Dana, that you put a list of resources in the chat, which we will share out as well after this is over.
Thank you so much for having us.
Thank you both very much for talking about this. I think it's a great program, and I hope you get a great turnout.
Thank you.
Thank you so much.
Thanks for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.